I'm going to start off by discussing what the pathologist does and how they participate in the care of a cancer patient. So, typically, a cancer patient goes to the doctor with symptoms, and particularly for those with brain tumors, an MRI is done, and at the time a mass lesion is found, a surgery date is scheduled. Although the surgeon and the oncologist may have some suspicions as to what kind of a tumor it actually is, the ultimate responsibility for making the diagnosis as to what type of cancer it is falls into the hands of the pathologist. So I'll start off by telling you what pathologists have traditionally done and how the field is changing and moving towards a different type of diagnosis. So when the patient is on the operating table, the surgeon may want to have a first impression as towards what type of a tumor it actually is, because that may guide what the surgeon actually does during the operation. And at that point, they do something that's called an intraoperative frozen section. That is, a small piece of the tumor tissue is taken while the patient is in the operating room and brought upstairs to the pathologist suite. A pathologist is an MD, a doctor who spent years studying cellular architecture and what cells look like under the microscope. And that pathologist takes the piece of takes the piece of tissue, which is sort of gooey in consistency, almost like scrambled eggs, and freezes it so that it becomes hard enough that they can actually cut a very, very thin piece of that tumor tissue. So thin it's actually 5 microns. You could barely see such a thing. And they put it on a glass slide like this. Then they stain it with a dye that allows them to look at the cells, and then they use a microscope like this to look at the cellular components, and based upon the architectural pattern, to make a first impression diagnosis of what they think the tumor actually is. That information is then conveyed to the surgeon, who uses it to decide what to do next in the surgery, or to see if it confirms with their thoughts about what's actually going on. However, that's not the final diagnosis. What happens after the tumor is then taken out of the patient is, again, it's a mass of tissue that has consistency essentially like scrambled eggs. And that tissue is taken and it's fixed in a fixative called formalin that allows it to become quite firm. And then it's placed in a wax block like this. So literally you can see pieces of tumor tissue placed in a wax block and put in a cartridge like this. This allows very thin pieces of this tumor tissue, again 5 or 6 microns, to be taken and placed on a glass slide like this and stained with dyes to allow the pathologist to have a good look at what the cellular architecture looks like. And the cornerstone of pathology-based diagnosis has been the architecture of the cells under the microscope. That is, certain criteria about the appearance of the cells allow the pathologist to say how severe the tumor is, what type of tumor it is, and the like.